welcome to Village in Motion on this beautiful, beautiful snowy morning. Well, beautiful, we didn't have to get out on the roads, you know. It's our staff who had to do that. But every place you look on this campus, it is absolutely astounding. But let's not look inside. Outside. Let's look inside, because we have with us today our good friend, Dr. Janice Gable, and welcome again.
Good morning.
It's always a pleasure, because I know, and our residents know, that we're going to listen up to your message, okay? And we're going to talk about chronic kidney disease today. All right, it's your show.
Kind of a hidden problem. When the doctor says, "How are your kidneys?" People think about how well they're urinating. But a much more threatening problem is chronic kidney disease, which is what leads to dialysis. Another, besides the outcome of the kidneys just not working, it's a big issue for older people, because kidney function affects how well our bodies handle what goes in our mouth, including medications, foods.
Surely.
So it's something that's surprisingly silent, but surprisingly common, chronic kidney disease.
And we certainly can't see it.
Right.
But is there, how would people know? What would we experience if we were approaching chronic kidney disease?
Well, this is going to scare you, because the symptoms are symptoms that are so common that I think probably everyone listening is going to say, "I bet I've got that." But the symptoms of chronic kidney disease are things that can be caused by many other problems also. I'll kind of go in order of how they appear. Usually one of the first things is nausea or decreased appetite. Fatigue is a fairly early sign of chronic kidney disease. Anemia, it's one of the most common causes of anemia for our patients, chronic kidney disease. And the things that anemia causes, like shortness of breath with exertion, or just easy tiring, lack of get up and go. And I think even doctors, we sometimes debate, are these symptoms really from this chronic kidney thing that we can detect in blood work, or are there other causes of it? Dry, itchy skin. Changes in urination are sort of a later sign, either urinating more and it's an unconcentrated urine, it looks like water all the time, or even later, decreased urine production. And then fluid retention, that is a later sign, but swelling in the feet, feeling short of breath from fluid in the lungs, difficulty in handling fluid balance. There is since those symptoms are so common, how doctors investigate those symptoms to try to determine if they're caused by chronic kidney disease. There is a number, just the way that we have a number for blood pressure, and everybody's kind of gotten familiar with that. And there's a number for blood sugar, of course, weight. People in thinking about their health have gotten used to asking about their cholesterol number. It took a while for us to get feeling comfortable with that. There is a number, and I'll bet not 2 people in Green Spring Village know their number.
Which relates to kidney?
Kidney function.
I'm sure not.
The number is called, the name of the number is the glomerular filtration rate.
Okay.
GFR.
We've got GFR. All right. We've got that up so people can see that term.
Glomerular filtration rate. Now, what this number tells us is it's got the word filtration in it. The function of the kidneys, just to be sure we're all on the same page,
Yes, please.
is to clean the blood, to get rid of wastes. And they work like a coffee filter. Some things go through and some things are held back. Chronic kidney disease is failure of the filtering function.
Of the kidney. Okay.
So what we start to see is things coming through the filter that should be being held back. That would be abnormalities in the urine. And what we look for there particularly is protein. The filter should hold all of those good proteins in the blood all the time. It's not normal to have any significant amount of protein coming through in the urine. And what we look for in the blood is a buildup of the wastes that should be going out through the filter. So the filter may be letting through things that should be retained, or it may be not getting rid of things that should be excreted.
So we're talking about the blood and urine being tested.
Right. The GFR, the glomerular filtration rate, is a blood test. The fancy version of this kind of testing is to test both blood and urine over a 24-hour period, and some people probably remember having that done. That's called the creatinine clearance, which is another, creatinine clearance is another term for this measure of how well the filters are working. But now it has been learned from several large studies that we can estimate that filtration quite accurately just from the blood test. The gender, the age is important, the weight, or sometimes we also look at some other things in the blood, the level of protein in the blood, and some other wastes in the blood besides this one substance, creatinine.
So you really have to look at all of these measurements kind of together.
Right, to really have it meaningful, we have to think about age, we have to think about body size. So, but there is a bottom line to it. It is that you can ask the doctor, what is my GFR? And the doctor can tell you a number. Now, something that is interesting, the point we are in medical history right now, is that we are saying that it's normal for that to go down with aging.
For that number to
Right.
lessen
Right.
with the aging process.
Right. And it, you know, a lot of things, we've learned a lot of things from epidemiologic research the last 50 years, including that osteoporosis is not normal, even though it's common, that high cholesterol, that cholesterol's in the 300s, even though they used to be common, were not normal. So, you know, it's a question whether this is really normal or whether it's just common. But one of the reasons I decided to talk about chronic kidney disease today is that Medicare has started recognizing different stages of chronic kidney disease. And so we've recently undergone a change in how we tell Medicare about your the state of your
Our
kidneys.
condition.
Right. We used to refer to, by used to I mean a month ago.
Okay, that close.
Yeah, doctors used the term renal insufficiency or chronic kidney failure. And that terminology has now all been subsumed to chronic kidney disease, and we're all trying to get used to using that term, chronic kidney disease, CKD. So if you have seen in your list of diagnoses renal insufficiency or kidney failure, chronic kidney failure, chronic renal insufficiency, mild renal insufficiency. We're trying to change all of that terminology to stages of chronic kidney disease. So this is new for the doctors too, and I'm sure it came from kidney experts, but it's been funneled through the
Medicare.
Medicare, right.
Medicare is, my goodness.
Yeah, they drive a lot in how medical care is done.
Right.
But there is the nephrologist. Nephrology is the specialty of medical kidney disease, where urology is the specialty of surgical kidney disease.
Okay. Now let's stop here a minute, please.
Okay, good
Let's
one.
go back. Nephrologist. Now, describe or define that.
Yeah,
Nephrology.
a nephrologist is a subspecialty of internal medicine, and generally we see them treating chronic kidney disease of all types, and interestingly, blood pressure. They're kind of the ultimate specialist for blood pressure. They are the specialists that we turn to if people's sodium is out of whack, if their fluid balance is out of whack and we can't figure it out. They're the specialists we're likely to call in. So nephrology is the specialty that deals with chronic kidney disease.
Okay, and I think we could take this opportunity to say that if the nephrologist has not already started, we have one who will be seeing patients here at Green Spring Village. We've been trying to get a schedule and get the nephrologist on a program to talk with us. And we'll keep trying, and we will get Dr. Jacob, Yacub, Y-A-C-U-B, Yacub, nephrologist. Check in the medical center if you need to. Okay, now that's nephrology.
That's right. And as of today, everyone that's listening to the program can find out how pertinent that is to themselves by asking about this number. So the way this goes is that stage 1 is an abnormality that usually does not cause symptoms but can have implications for medication dosing. For instance, an antibiotic that's eliminated through the kidneys may need to be dosed slightly lower if you have early chronic kidney disease. Stage 2 has some further implications and may affect how your blood pressure is, because even though it's not intuitive, the kidneys have a great deal to do with blood pressure control.
That's why diuretics have been
right.
ordered,
sometimes
been a part of that treatment often.
And stage 3 chronic kidney disease still will probably be managed by your primary care doctor, but is where we start to see problems of anemia emerging. Another not intuitive fact is that the kidneys have a lot to do with how well the bone marrow produces blood.
All right.
Yeah.
You know, the saying is, if you say so, Doc.
Yeah, that's a wonderful subject, and it would be great to have Dr. Jacob explain how that is. But the kidneys, in addition to their filtering function, they contain sensors sensing what the blood pressure is and sensing how well the blood is carrying oxygen. And there's a biofeedback mechanism where when the kidneys sense a lower blood pressure, they send out signals to constrict the blood vessels, to retain fluid, to do things that'll up the blood pressure. So a failing kidney gets goofed up on its job of management of blood pressure. In the same way, the normal kidney has a job of sensing when the blood is not delivering enough oxygen, and then sending out signals to tell the bone marrow to adjust for abnormalities. And a failing kidney also does not handle that function correctly. So stage 3, we start to see anemia. Stage 2 and 3, we have more problems with blood pressure management. And stage 4 is we're starting to think about dialysis. Can these kidneys really do what they need to do? And that's usually where the nephrologist comes in. And those stages are defined by numbers of the glomerular filtration rate.
My.
It's pretty complicated, isn't it?
And we will be, doctors will be having discussions with patients about these factors, won't they?
That's right. And it's kind of something, as I say, even though we don't feel our cholesterol, we've become accustomed to being very interested in what our cholesterol numbers are because we know what the implications are for that number. And I think that we want to start thinking about chronic kidney disease or making it more of a health awareness thing in the same way. The causes of chronic kidney disease, if I talk about that, that might bring it closer to home because that, even though there's, I kind of think that the awareness currently of chronic kidney disease hits when dialysis is looming. But there are the other implications for it, how your body handles what goes in your mouth.
Which we should be alert to.
Exactly, right.
Before we get to that other stage.
Yeah, so we really want to raise kidney thinking. The causes of chronic kidney disease, hereditary kidney diseases, the most common one is polycystic kidney disease. So if there has been kidney disease in your family, if people have ended up with dialysis or have ended up dying with a lot of fluid retention, things like that, you're probably aware of it. But the other two are diabetes and high blood pressure, which those two things are the predominant causes of chronic kidney disease.
Diabetes and high blood pressure.
Right. And we like to think that they only cause it when they're uncontrolled, but our idea of control has really changed in my lifetime as a doctor. So unfortunately, residents of Green Spring Village have gone through this history of what is good blood pressure control, what is good diabetes control. So they may have in their history a period of time where those things were not controlled to the level that we now know is important for good kidney health. So, and then that turns the other way too. Once some chronic kidney disease is present, which, like I say, I think if everyone starts asking their doctor, they're going to be surprised that we will be saying, yeah, I haven't really mentioned that, but you do have mild chronic kidney disease. And, you know, we're making ourselves be more
alert to
more
that.
Right, more communicative about it. But when some chronic kidney disease is present, that also changes what we want the goals to be for your blood pressure. So if you have some chronic kidney disease, the blood pressure needs to be lower. And how low is determined by that number, the glomerular filtration rate.
The GFR.
Right.
GFR, not giraffe, but GFR.
That's a good way to remember it.
Well,
Yeah.
This poor brain has to have
You have the memory
hitch-ons.
memory tickles, yeah.
Yeah.
So when you know what your GFR is, that will tell you what the goal is for your blood pressure control. If you are diabetic, we now know that, and our number for telling how overall control of diabetes is the A1C. The A1C needs to be in the 6s, so you diabetics know what that means. The other people don't need to worry about it. But for taking good care of your kidneys, if you're diabetic, your A1C needs to be in the 6s.
And if you're diabetic, you have been clued to that by your physician saying your A1C is
And you'll
so
get
and so, and that's
right.
too high.
That's right.
Or it's so
Yeah.
and so, and that's too low.
Right, and one of the implications of that is that you may be knocking out your kidneys.
May be causing difficulty and diminished the
Filtering.
function of
Right.
the kidney.
Right.
Okay.
There are a few other, there are other things that can cause chronic kidney disease that are not as common. Primary diseases of the kidneys like nephritis, that overall term used to be called Bright's disease. Glomerular nephritis, glomerulonephritis occurs at all ages. There are children with chronic kidney disease right on up through. There are, if you have any reason to have low flow of circulation through the kidneys, that can cause chronic kidney disease. So one of those possible causes is congestive heart failure. Now we're starting to bring just about everybody in. Things like dehydration can cause low flow of blood to the kidneys and can damage the kidneys.
Here we go again. 6, 8 glasses of water.
Yeah, afraid so.
Oh, see,
And-
if she's going to remind us of that.
Yeah. With respect to chronic kidney disease, sometimes we have to, in the later stages, the more advanced stages of chronic kidney disease, we sometimes have to get really hicky about what we're putting through the kidneys, which is determined by what goes in the mouth. And sometimes we have to put people on an actual measurement of how much fluids they take in. Sometimes we even have to limit that if the kidneys are having problems putting out water, if people are in the stage of fluid retention from chronic kidney disease. And there again, there are so many reasons for fluid retention. It doesn't necessarily mean that that's being caused by chronic kidney disease. But if it is, you need to be aware of that. Low sodium is helpful to the kidneys because sodium is one of the things that has to regulate closely. Generally, the kidney-friendly diet is a low-sodium diet. Sometimes, surprisingly, we have to put people on a low-potassium diet. Phosphorus is another one of the minerals that the kidneys has to regulate hour by hour. Sometimes we have to pay attention to that, and phosphorus is in meats, in protein foods, in sodas,
In sodas.
yeah,
Okay.
in sodas.
Water, not sodas, she's
Right,
saying.
right.
Okay.
Do as I say, not as I do.
Well, we're not going to hold you to
Yeah, right,
that,
right.
Dr. Gable, honestly. Well, we're kind of getting toward the end of our time allotment here, but kind of as a summary for our residents, number one, she just repeated and emphasized the water intake, but are there some other things that you want to leave with our residents about this whole kidney potential problem?
There are medications that can damage the kidneys. The one that doctors think of the most, maybe not because it's the most hazardous, but because it's the most common, is everything in the arthritis line. The ibuprofen, the Motrin, the Aleve, naproxen, both prescribed and not prescribed. If you are not aware of where you stand in this whole world of kidney function, you can damage yourself thoughtlessly by using medications that can be damaging. So I guess my bottom line today is we doctors need to be communicating more about chronic kidney disease. We are thinking about it, and we do things with that thought in mind, but we need to include the patient more, and we the patients need to remember that that's an important number right up there with the cholesterol, the blood pressure.
So that what if there is a parting message to our residents? I hear you saying that it is for us to check with the doctor if our doctors have not discussed this
Yeah,
with us.
I think so.
To say, well, there's a number I'm supposed to find out about my kidneys, and the doctors will then explain a little more, and we'll keep up on that, right?
And I think once you have yourself placed in the world of kidney function, then you can go to a website, you can do some research, and learn some more about how to take care of your kidneys.
Boy, how about that? How about that? You know she's been to the website. Dr. Gable, we really thank you so much for visiting us regularly and sharing. It's just really very valuable to us.
Great.
So we'll say to you publicly, happy holidays.
To you too.
And then we've got some other things to say to residents here. Number one, we have a special announcement that tomorrow, Wednesday the 7th, there will be